Tyler Williams at Pinecrest Dental. Thanks for checking out this video. You're here because you have questions on how long dental implants last. And this is a question many patients have asked us over the years, whether it's replacing a few teeth or getting a whole new smile, or maybe a combination of implants with enhancing your teeth with veneers or whitening. We want to know how long is this going to last, right? So typically what you'll want to look at is how many similar cases that the dental team you're working with has done, right? And, there are offices that just do thousands and thousands of these. Some of them move people in and out pretty quick, and that may or may not be for you. But what I'm getting at is asking them, hey, when you work with other people, what are some of the results you've seen? Or what are some things that would make them last longer versus shorter, right? So part of it is the experience of the team. The other half of it is what you're willing to do on your end to help them last, right? So if you think about it like a car, if you upgrade your car to a high-end luxury vehicle, then there's probably going to be more work to do, not less than what you've typically done in the past. Then that's kind of like, with this new vehicle, you're going to have to change the oil and rotate the tires and maybe even do more maintenance on your previous car. So a lot of our patients with implants, they're coming in every 3 months or every 4 months for maintenance, not every 6. So the first thing to understand is that getting implants does not mean that you don't have to go to the dentist again. You're going to have to keep a regular schedule if you want to keep your implants safe and healthy. So implants can't feel pain, they can't get cavities. But the downside to that is you can actually be losing bone and have receding gums around your implants and have no idea because it's not really hurting. And these can be influenced by things such as not flossing regularly or not using a water pick, not brushing around your implants, not taking appliances out regularly. The types of food you eat, more processed foods, are going to cause more plaque. Not seeing your dentist regularly for maintenance on those. Drinking water between meals. If you smoke, if you have sleep apnea or dry mouth, or you have medications for autoimmune disorders or diabetes, or if you've had cancer treatment. Pregnancy is a big one. So these are all things that can influence and factor the length of your implants. Now, typically, if we're looking at someone who's looking at an option and we don't think it's going to last 5 years or more, then we won't do it. And the reason I use that number is we found that if something works well for 5 years, it's probably going to last a lot longer. If an implant has a major problem, it's usually in the first 6 weeks to a couple months. And so you want to be looking at that when you're getting implants is how long is this going to last? How can you make it last as long as possible? And are you a good candidate for implants? Some people aren't, but most are. If you've been told that you don't have enough bone or your jaw's too thin, then things have changed and you probably have some options that you weren't aware of. I can't tell you how many people I've met with over the years who've said, yeah, a dentist told me I didn't have enough bone, or I don't think I have enough bone, or has my jaw shrunk down too much that I can't get implants? And we can help most of these people. In fact, I can't think of many that we haven't been able to help. And so those are the kind of questions you want to ask. Now, generally speaking, implant should last you for years. Okay, that years can be very open to interpretation, but usually implants will last at least several decades, if not the rest of your life, if maintained well. Now, the teeth attached to the implants, meaning your bridge or your crown, or if you're all on four, those kind of things, right? Those may need some maintenance a little more often because those are doing the biting and the chewing. So if you have teeth grinding or sleep apnea, make sure you're wearing a mouth guard with your implant. That will help it last longer, as one tip. If you have some questions on your specific case, don't hesitate to reach out to us. And you can check out our other videos that talk more about the differences between implants versus veneers versus saving some of your teeth versus removing all of them. If this has you thinking now, well, maybe I should consider saving my teeth or removing them. So thanks for taking a minute to watch this video, and we'll catch you on the next one. Have a great day.